everyone. Thank you for joining us today. We're going to start very shortly, but we're going to give people a few more minutes to come in. So we'll be back in just a moment. Good afternoon, everyone. My name is Kathleen O'Donnell Pickard. I'm an occupational therapist and certified hand therapist with Spear Live. I'd like to welcome back those of you who've attended one of our webinars before, as well as welcome those who are joining us for the first time. We appreciate you taking the time out of your busy days to learn with us. For those of you who do not know who we are, Spear is a private outpatient practice that has been around for over 20 years. We currently have 21 locations located all over the New York City area, and we've successfully continued to offer in-person care throughout the COVID-19 pandemic, along with launching Spear Live for those who are looking to stay in and receive care using our telehealth platform from the comfort of home. In our clinics, we are strategically going above and beyond the CDC guidelines to ensure safety and the well-being of everyone. You can find more detailed information on those safety measures by visiting our website at spearcenter.com. But we're here for you in whichever way makes you feel comfortable. If you're looking for individualized care, either in the clinic or through telehealth, please reach out to us at your convenience and we'll get you set up for an appointment right away. So today we are excited to be with you to discuss returning to running after an injury. We're going to be discussing rehabilitation timeframes and rates of re-injury. We'll be focusing on understanding the foundation of strength, flexibility, and exercise tolerance needed before running or returning to running. And we're going to discuss common functional assessments to measure readiness to returning to running, specific protocols, factors that affect returning from injury, and common running form mistakes. We got a lot going on today. As you can see, we're coming to you live from various locations and various Spear clinics. So although we don't anticipate any technical difficulties today, please be patient with us should any arise as we navigate working through technology. So just a little bit of housekeeping. Throughout the webinar, we want to hear from you. So if you have any questions, please feel free to let us know your thoughts in our Q&A feature. So to find where that is, just take a moment to hover your mouse at the bottom of your screen. You'll see a Q&A option pop up. That's where we want you to put the questions. We'll do our best to address as many of them as possible during the webinar, but it's best to put those questions in the Q&A. If you put the questions in the chat feature, we may not get to them. So for those of you who are watching through our YouTube link, we are monitoring the comment section as well, so feel free to type your questions in. And then lastly, there's going to be times where there's multiple panelists on the screen. So for the best viewing experience, please select gallery view at the top right corner of your Zoom screen. You'll be able to see multiple panelists at one time. All right, so let's talk a little bit more about our goals for today and what we're going to be covering. So our presenters are going to go over the process of returning to running after an injury from a physical therapy perspective. They're going to cover tests and exercises frequently performed during physical therapy for runners. They're going to go through a sample running progression following injury. And then lastly, how to transition from rehabilitation to maintenance for a continued progression. So before we get started, I'd like to introduce you to our wonderful team of panelists. We're going to welcome everyone onto the screen now. All right, so we have our presenters today. We have Jay Kwan, who's a physical therapist from one of our Upper West Side locations. He's on 67th Street. And Amanda Kalin, who's a physical therapist from our Chelsea location. And then lastly, we have Brett Warner, who's a physical therapist, as well as our assistant clinical director from our Park Slope location. He's going to be helping us with answering questions in our Q&A feature today. So as a reminder to everyone, it's best to be in that gallery view so you can see everyone at the same time. If you've done that, you should be able to see all of us right now. All right, so let's get started. Amanda, Brett, and I are going to say goodbye for now. And Jay, we're going to let you take it away.
All right. Thanks so much, Kathleen. Hi, everyone. I am so glad you guys could all make it here today. Amanda and I are super excited to talk about this topic as it's one that's very near and dear to both of us. Just as a quick disclaimer, the contents of this webinar shouldn't be taken as a strict medical advice or as like a how-to guide. If you are injured, we definitely recommend you seek out medical attention from a licensed healthcare professional. So with that said, I want to start today with just a little bit of background on why Amanda and I want to cover this topic as the topic of our webinar tonight. So, returning to running after an injury can be often a tricky and daunting endeavor. A lot of us know the feeling. We get hurt, it really sucks. Over time, with or without rehab, the pain goes away. And then, like, can I run again? Is it safe for me to? Is my injury going to come back? What if I get hurt somewhere else? How much should I run? Where should I run? How hard should I run? What should I do about my shoes? A million billion questions start to circulate around in our head. Or maybe this sounds more familiar to you. No pain? Great. I'm just going to go, go, go. No pain must mean everything's good, right? Fantastic. Even if there is, no pain, no gain, right? So, regardless of which approach you take or resonates more with you, this is often the part where things kind of stall out. And this is particularly concerning, primarily in light of the fact that running injuries often seem to precipitate future running injuries. Let me know if this sounds familiar to you. You get injured, you get better, you start running again, you feel really great. You go strong for a few weeks, maybe even a few months, then injury comes back, or you end up getting hurt somewhere else. Before you know it, you're stuck in a vicious cycle of injuries and not really able to enjoy the sport for really all it has to offer. A lot of times, this comes down to a case of expectations really exceeding reality. Hence why it's so vital that the process of returning to running be done patiently and methodically. You have to know where you are right now in terms of injury recovery, and also where you need to be going and what you have to do to get there. So going off of that, it is crucial that you know the nature of your injury first. And to talk more on that, I'm going to hand it over to Amanda.
Awesome, thanks, Jay. So first, I kind of wanted to start going over two types of common running injuries that we usually see in the clinic. This isn't like a comprehensive list or anything, but these are just the most common ones. So they are like bone stress injuries or stress fractures, and then you have your tendon injuries. So bone stress injuries in runners kind of result from that failure of skeletal bones to withstand that submaximal repetitive force. So your stress fractures occur kind of as a result of overuse to that bone, and it can either be kind of from either what's called bone fatigue or bone insufficiency. So fatigue stress fractures occur when normal bone is unable to kind of keep up with the repair that happens when it's repetitively damaged or stressed kind of as you're running or constantly loading those bones. And then you have insufficiency stress fractures, which occur kind of in a bone that is pretty normal, but is under normal strain, but can be structural abnormally just kind of due to other bone diseases or really osteoporosis. So common sites that we see for bone stress injuries or stress fractures are usually in the lower body, which is very common in running injuries, obviously. So those common locations are in your femur, in your tibia, your fibula, and really bones of the foot, such as your metatarsals, tarsals, or your heel bones, such as your calcaneus. These type of injuries really do occur due to modifiable risk factors, kind of such as your physical fitness level, your training volume, so your cross training, your mileage, your intensity, your recovery periods, nutrition such as calcium and vitamin D, your caffeine intake if you're a smoker, non-smoker, and stress, which can be how much rest you're getting, how much sleep you're getting, and other physiological life stressors, work or family things that are happening. I think Jay and I feel pretty confident in saying that kind of about 90% or greater of the running injuries that we see in our clinic are kind of due to training errors and can kind of easily be fixed. When we shift over to tendon injuries, we kind of look at that term tendonitis, which I'm sure many of you have heard before. And that is that inflammation of the tendon that results from micro tears that happen when that musculotendinous unit is pretty much like overloaded pretty acutely with a force that is too heavy or all of a sudden too sudden. Tendinopathy, or kind of that umbrella term, is really the degeneration of the tendon's collagen in response to that chronic overuse that's happening. So when that overuse is continued without really giving that tendon time to really rest or heal, that's where you get that repetitive strain, and that's where those tendon injuries really start to occur. When we look at kind of like healing times for tendonitis or tendinosis, tendonitis can really heal in a couple of days or really somewhere up to 6 weeks, kind of depending on when your treatment started, when your injury was, and what kind of presentation you really have with it. Then when we kind of look at those more like chronic tendinosis type of injuries, really they can kind of be pretty brief for about 6 to 10 weeks, but sometimes they can really start to linger around for those 3 to 6 months period or even longer. So if you're kind of dealing with that nagging injury that really won't go away from that tendon, this is kind of that umbrella term that we're looking for. So if you're already kind of dealing with that bone stress injury or that tendon injury, how do we get back to running? It's kind of that overall question that I'm sure everybody's asking. So when we start thinking about it kind of from our point of view, it's really important to think about some activity modifications. If you have a bone stress injury or a bone fracture, this might mean a period of time where you're not really weight bearing or there's really no high activity impact sports such as you're running. Again, this will kind of depend on where the injury site is and really how much damage has occurred or how much time has passed. We kind of like to think of it most importantly of that graded exposure. So once you kind of no longer have pain with your daily activities or at rest, we can kind of start to gradually reintroduce physical activity and that tendon or bone loading. So really progressive loading exercises do need to be performed even when you are dealing with an injury. These type of exercises are really necessary to kind of optimally load that bone and tendon so it can now tolerate what you're looking to do, running those repetitive submaximal forces that occur with high impact activities. So basically, when can we return to running? Generally speaking, we kind of like to think of returning to running or starting a running protocol when you can kind of check mark a couple of these boxes. So that includes unilateral or one-sided loading of both of your lower extremities with that good postural stability, being able to perform what we call just a functional strength training program, having the ability to repetitively hop on each leg multiple times in various directions, so you're forwards, backwards, sideways, however, and then really being able to tolerate that walk running routine. So as clinicians, we sometimes like to follow kind of those two-phase rehab return. So phase one may or may not kind of include your weight bearing as tolerated or some walking modifications, but we're kind of going to say that running should probably be avoided in this stage. Again, everybody's different and sometimes you can run, but generally we'll say that running needs to take a little bit of a break. But you still can perform very light impact cardiovascular training, such as your cycling or your swimming. And this is where we start to introduce kind of like a low level functional strength training. Once you kind of have hit that point where you're pain-free with your walking and daily activities and that low-level functional training, that's when we can kind of start focus on that return to sport or that full progressive cross training. So our second phase really focuses on muscular endurance training, your core and pelvic girdle stability, your balance training, and really starting to get back into your functional tests. So you've kind of started to check the boxes of your strength, getting back your range of motion, your flexibility, and your plyometric tolerance or impactful loading through jumping and things like that. After that base is pretty much established, we are ready to return to a running protocol. But again, as clinicians, we like to check all of our boxes. We like to be able to test to make sure that you're really ready to sustain those high impact forces. So what Jay and I kind of like to do is called our like physical performance tests or clearance considerations. So Jay and I are going to kind of review some of those performance tests that we like to look at before deciding if it's pretty much ready to return to running or not. And what we do show you can also then be used as exercises in kind of that like phase 2 muscular endurance training, balance training, and plyometric training as well to get you back into your running. So the first one that I kind of want to start, as you can see on the screen, is called a lateral step down. So I have my step over here. Any step or stair that you really have will work for you. Basically, what this is kind of working on is you're going to have your quad strength and your glute strength, and working on kind of that single leg stabilization or stability that you need for running when you're obviously putting weight through that leg and that forceful impact. So one foot is going to go on the step, and this is going to be your affected or your injured leg, and your other one is just going to be kind of hanging off the step. The goal of this is basically just trying to tap your other foot down onto the floor very lightly, so you're not putting weight onto that side, lowering yourself down nice and slow, tapping that foot down and standing back up. But cues that we kind of look for is making sure that this knee that you're standing on is staying in line with your toes. So as you're stepping down, you're not coming inwards and down and across the step, kind of having this collapsed position. We also like to look at too, kind of those like bony points on your hips. We call those pretty much like headlights. You want to make sure that they're staying pointed straight and that they're even with each other. So a lot of times as people will do a step down, this will kind of happen. I don't know if you can see my fingers, where one hip is staying pretty much in line and the other one is dropping down. That's a hip drop, and that's something that we want to start staying away from. So basically you want to keep your headlights pointed straight, and you're just nice and slow tapping down and stepping back up. As this is kind of now your performance test that you're looking for, you're basically looking to be able to perform that type of activity 10 times in a row with good postural stability and no compensations occurring. You can also too set a metronome to 30 beats per minute, about 30 to 40 beats per minute, and time your steps up and down to be able to kind of match that beat. So it's a little bit on the slower side, but it will really help be able to control and have the correct muscle activation that you're looking for. So our second exercise that I want to show you is basically called a single leg heel raise. So as you're looking for it, you want to be able to take your heel off of the ground. So standing on one leg, you're going to be lifting your heel up off the ground, or from this view as well, up and off the ground. This is really important to start strengthening the muscle of the back of your leg, your calf, or your Achilles tendon as well. As you're running, a lot of your push-off that comes from run will come from this muscle right here. So as you start strengthening and training this calf and the Achilles, you're going to basically improve your running efficiency, because all of the weight and impact that goes through this muscle as you're running is going to help push you forwards. So same idea of making sure you have that nice, good postural control. Sometimes I'll do it with my hands on my hips or just my hands at your side. You're going to come up onto your toes and lower back down. Basically what we're looking for with this is, like I said, none of that wobbliness as you're coming up and coming back down. And we like to make sure that you're able to perform that activity 25 times in a row to then be able to make sure that you can kind of withstand that force that you're looking for as you're running. So now I'm going to bring Jay back onto the screen, and he's going to go over the next two exercises with you.
Those were some fantastic lateral step downs right there. Good job, Amanda. All right, so the third exercise we are going to cover is a bridge. So we're going to be, I know a lot of you are familiar with bridges either from yoga or other previous episodes of physical therapy. The kind of bridge that we're going to do is a variant. So what we're going to be doing is we're going to be combining it with a straight leg raise. So I'm a huge fan of lateral step downs, just because they kind of target multiple muscle groups at the same time. So I love getting like the most bang for my buck, essentially. So the single leg bridge is also very similar in that it targets your glutes, it gets a little bit of your hamstrings, and because you are going on one leg, you really have to engage your core to stabilize yourself as well. And when you're on that one leg, the leg that's up, you engage your hip flexor as well. So we're knocking all the muscles here. So I'm just going to demonstrate real quick what I look for when I have my patients perform a bridge with a single leg raise component to it. Just going to tilt this down. All right. So what you're going to be doing is you're going to start right here. I personally like to put my hands on my pelvis right here, just so I know if things are being kept equal or not, if one hip's dropping. So from here, squeeze your glutes together, and then you're going to bridge up. Then from here, just raise your leg like this, and then you can hold it for a little bit, come back down, repeat. Do it on the other side. I am kicking the wall now. All right. Like so. And a progression of this would just be going right, straight at the leg, and doing it as such. So what you don't want to see with this one is when you go up, you're dropping the hip like this. So you really do have to engage your glutes and your core to keep yourself level. All right. That's good right there. So that's how I would coach it as an exercise. So when we're doing it as a performance testing measure, generally speaking, what we try to go for is performing a hold for about 30 seconds on each side. That kind of indicates to us that like your glutes, your core, and all those muscles that we just walked through are pretty well toned to withstand kind of the stresses, maybe not the stresses of running per se specifically at this point, but the foundations have at least been laid pretty well. So the last exercise that we will cover is called a pogo jump. So up until this point, we've really focused on exercises that are more strengthening and endurance in nature, where we were focused on doing them slow, controlled, focusing on contracting the right muscles on. So the next exercise kind of bridges the gap between strengthening and also getting it a little bit more running specific. So we're going to bring it all together. So what pogo jumps are is you're just going to be hopping on two legs or one leg as a progression, and you're just kind of hopping nice and light, kind of like you're jumping rope in a very rhythmic fashion. So I'll turn the computer over. Okay. I'm just going to back up a little bit. So again, I like to start with my hands on my hips, and you go just nice and soft like that. And string a couple of those together. What I don't want to see on a pogo jump is this. I'm not sure how well you guys were able to hear that, but you want to land as smoothly and kind of really using your muscles to kind of like catch and react to the forces that you're putting through the leg. So when we're doing it as a test, what Amanda and I generally like to do is we set a metronome to about 150 beats. That's roughly this. Boom. So we hop, 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 hop. We would progress it to a single leg version. And we'll see if for about I like to do it so that my runners are tolerating it for about 30 seconds without any pain and showing good mechanics like I just described. So with that, we can go back to the PowerPoint and get back to how we're going to start running again. So that was a lot harder than I thought. Wow, I'm a little out of breath here. Okay, so that was just a very quick run through of some of the many exercises and assessments that we as PTs make use of when we're trying to return a runner back after injury. Just to emphasize, the specifics of rehab should be tailored to your injury. And all of these are used in service to sound clinical judgment to make the final decision of when you should start running and how you should start running. So let's say we've ticked all the boxes. Range of motion, check. Strength, check. Balance, check. Plyometric tolerance, it's all good. Now what? Run 26.2 miles. Not quite. You've now successfully gotten to the starting line, so to speak, and we are nowhere near the finish line. Excuse me. Even going from single leg hopping, like we just showed, to jogging for a small chunk of time is a huge relative jump, no pun intended, in the level of stress you're going to be putting your body through. The biggest thing that I tell my runners at this point in rehab is that running should not be thought of as cardio. I will repeat that because this is probably one of the most important points that I will make tonight. running is not cardio training at this point in rehab. It is purely a low tolerance building activity. If your athlete, or if one of my athletes does want cardio at this point, I generally tell them to try swimming or biking if they're already familiar with doing it. And if that's all a pain-free, well-controlled activity that they can do, they can keep their cardio up, not a problem. Not with running, because we are in rehab specifically to rehabilitate back to running, and we don't want to kind of like go too fast at this point. Remember when I brought up earlier that a ton of runners end up re-injuring shortly after getting back from an injury? This is where a lot of it happens. Think about it. We're now going to be subjecting the body to 2 to 3 times your body weight with each footfall, and those footfalls add up really quickly. That's a lot to be putting on a hurt body part. Not only that, but if you've been in the sidelines for any extended amount of time, all your other tissues, your muscles, your tendons, your bones, your ligaments, all the non-injured stuff, the stuff that's not currently injured, they've probably deconditioned because they've been, rightly so, spared from the stresses of running for a long time. And if there's something that your body does really, really well, and it's kind of like a double-edged sword, it is to adapt to the demands you put it on, or in this case, lack thereof. Running is not cardio. I cannot emphasize this enough at this point. So how do we get back to regular running then? So we as PTs at this point generally prescribe a walk-jog progression. Now, there are scores of different protocols out there, and it's not the purpose of our webinar tonight to discuss the merits of one versus the other. The idea is really simple. Start to build a runner's tolerance to the activity by having them run in short intervals, followed by a walking rest, and gradually progress them in a variety of ways as they're able to successfully complete each step. Several things, though, to point out about how we choose our running progressions, because, like I mentioned, there's a lot of them. First, we have to know where we're going with it. Are we trying to get someone back to marathon training? Are we trying to get someone to run the 100-yard dash? Or are we just trying to get someone to run 3 miles 3 times a week, just as a hobby? As you might imagine, our end goal dictates how far we might progress in terms of duration and pacing. Another point to bring up is that regardless of where we are going with it, it starts with light jogging for a reason. This is because the forces that you put on your body significantly increase sharper when you increase speed versus the duration. For example, and this is just an example, increasing the duration of your run by 30 seconds is a lot less strenuous than speeding up your mile pace by about 30 seconds. The whole idea behind this is slow and steady wins the race. Finally, going off of that, the symptoms need to be followed very, very closely during the progression. There's no point in progressing to successive steps if we're just digging ourselves into another hole. That's the whole point of going very methodically and slowly like this right now. Depending on how the symptom responds, the pacing of the progression may change. Just a few examples without diving too far into the nuances of injury again. If someone with a bone stress injury, like Amanda talked about, starts complaining of soreness during the run, like in their injury site, I'm going to take that as a pretty big red flag, and I'm probably not going to progress them. As a matter of fact, I'm probably going to bump them down a few steps. So not only can you go forward in the running progression, but you can also go backwards. It's really based on like how you're presenting like. On the other hand, if someone with let's say, chronic Achilles tendinopathy, a condition that we know we can kind of push through a little bit of pain when it's controlled, if they complain of pain and it doesn't really change beyond like what they experience at baseline, I'm a little bit more comfortable with progressing them up. So as you can see, the condition really dictates how I'm going to be monitoring and what I do in response. So over here in the PowerPoint, I've just attached a sample running progression for all of you to see. This is the University of Delaware's running progression, specifically for athletes returning after ACL surgery. Amanda and I chose this one for a few reasons. It's very simple. It gets all the points that I just talked about across, and I went to Delaware, so I'm heavily biased. You can see how each step is laid out, level 1, level 2, level 3, level 4. You can see how the duration of the running is increasing first. You can also see to below the levels all the rules of the progression as well. So it says over here, mandatory 2-day rest between workouts first 2 weeks, do not advance more than 2 levels, all these little stipulations. Now, again, this is just one sample running progression. It is a very slow one because it's returning athletes after an ACL surgery. So not every progression is going to have the same rules. And you can see, this is what I really like about it. It says explicitly jog the straights. It does not get to run until the last step of the protocol, increase speed on straights, jog curves. So again, kind of going off the idea that if you increase your speed, that's a drastic increase in load. So now you can see how we start to rebuild our running. Let's say we meet all our goals and we walk through the progression successfully. What then? To talk more on that, I'm going to hand it over to Amanda again.
So pretty much like Jay kind of showed in the protocol, it's really important to build slowly and kind of factor in your recovery portion. It's not always going to be smooth sailing. There's going to be some setbacks, and that's very common in rehab and just in general. You honestly know your body best, and it's really important to know when to slow down, such as pain that really doesn't go away throughout a run. Maybe it gets better, maybe it doesn't, or kind of that soreness that's happening for a day, 48 hours, 72 hours, or even more than that. It's also really important to know when to stop, which is the hardest thing that we as PTs have to tell runners, especially those patients that find running as outlooks or training for something. We have to sit there and basically say, hey, you can't run anymore. So really keep your training up with kind of due diligence and train smart. Like we said earlier, it's really, we see kind of that like 90% of our injuries are due to those training errors. So kind of those common stressors to the symptoms that really can also affect your injury. We have seen through studies that less than 7 hours a day of sleep over kind of that 2-week period is really associated with newer injury risk. And studies have also kind of shown that less than 8 hours a night can really increase your rate of injury. Stress is also a huge factor in a lot of our lives. And we might even try to avoid some of the stressors, but we can't really control how they kind of affect us. A lot of people say that running is kind of their way to reduce their stress, but if there's too much stress in your life and on your system, you might also be increasing your risk of injury as you are running. So it's really important to start to train smart, kind of with that proper form, and really potentially have those pre or post run rituals that can help prevent injuries. Also, too, we also take a look at your running analysis or kind of your running form, which is also really helpful to prevent injuries in the future and help you kind of continue to run pain-free. There are a million running mistakes that can come out with a running form. Some of them I just want to quickly touch on is kind of just that hip drop. You can see from the first picture on the left that unequal hips, which come from kind of your weak hips or your underactive glutes, which can put your lower body in kind of like a compromised position as you're landing. You can be running at a slower pace or kind of a decreased cadence, which is measured by steps per minute, which can really throw off your whole form in general if you're just not kind of keeping up with the correct pace. You can also have a lack of correct lower extremity range of motion, which can lead to increased stresses or strains on your body. So you can see that picture in the middle, how that person's not really getting that full hip extension, that full knee extension, or that full ankle extension. And when they're landing and pushing forward, they're just putting increased stressors on the body. And you can also see sometimes too of having a different type of foot contact or putting the foot out too far in front of you, again, can kind of start to increase pain throughout your lower extremity and even up the chain as well. Sometimes really just a quick tweak to your form and that speed can really address these factors in a tremendous way. So it's really important for us to always kind of take a look at your running form before sending you out and running on your own. Also, a lot of runners will never do any strength training in their training as well. They're just fully runners. We really like to incorporate strength training for runners, and it's like imperative to help really reduce that risk of injury and help runners even get back to running. They can help improve your trunk stabilization, which is really important for your running efficiency. It helps improve your muscle activation and recruitment patterns, which is really helpful, and really help improve the amount of load that your body can handle and improve the force development and decrease the forces that really do lead to that injury or that repetitive stress. All of these factors really help a runner continue with the progress that they've made and prevent re-injury in the future. So I'm going to invite Jay kind of back onto the screen to help me wrap it up.
All right, all very solid points there. Once we get there, we don't want to undo all our good work and, get back in the vicious cycle of re-injuring. So thank you, Amanda, for going over that. So in conclusion, the key points from tonight are the nature of the injury must be known and rehabilitated accordingly. Work to do the basics really well. Remember, boring is good in this circumstance, and tests can be used to assess running readiness. And again, here I go again. I'm starting to sound like a broken record. Running is not cardio at first. You have to take your time and do your due diligence with it. And then from there, progress slowly and listen to your body, as Amanda just went over. So with that, we'll wrap things up. We hope you really enjoyed our webinar tonight. And I'm going to pass the baton back to Kathleen, and we'll be around to entertain any questions. Thank you very much.
All right. Amazing, guys. Thank you so much for all that information. We have a lot of questions to go through, so I'm just going to dive right in. So starting with what seems like something basic, right? What, in your opinion, is the best running shoe, or how can I figure out what the best running shoe is for me?
So I can kind of take a stab at that one. So that's like the first question that anybody always asks us when they come in with any sort of running injury. Is it from my shoes or my feet flat? Should I put arch supports in? The question is really that there's not any specific running shoe that either Jay or I are going to say, yes, everybody needs to go get these shoes. These are going to be your best shoe. Everyone's foot is very different. So there's going to be a specific shoe that works very well for you. So some people are going to come in and Asics are going to be the best shoe based on the arch support, where their foot's landing and things like that. And there's going to be other people that come in that can run in just your general running shoe, your Nikes, your Adidas, your New Balance, whatever. So that's a very common question we have. And honestly, it depends a lot on what your foot looks like and your running mechanics. So that's a question to ask really any licensed physical therapist or anyone else that you're really working with that might have a better idea specifically for you.
Is that something that can be kind of talked about at a running analysis?
Yes, so that is something that we really discuss at a running analysis to kind of look at what shoes they're running in. Do they run in the same shoes? Where they run in those shoes? Sometimes switching up your shoes can be a little bit different as well. So that's something that's a little bit more focused to you that can definitely be done in a running analysis that we offer here.
Awesome. So you guys touched on speed of running a little bit, but I know that protocol is pretty specific. Do you guys have any suggestions on how fast we should be running during this return to run protocol?
No, that's a really good question. So when we're doing the return to run protocol, and assuming that this is the first time, a patient gets back to running, it's their first couple running strides that they will take after a prolonged leave of absence from running. Generally, what I will go for, and I tend to be very conservative with this part, just because I don't want to, dive in way too quickly and potentially aggravate anything again, is that I will go for the slowest speed that you can run with just decent, comfortable mechanics. And that's more or less of a subjective choice. So for some people, that happens right around 5 miles an hour. Other people, they're a little bit taller, they can go around 6. It really does depend. But I would say the slowest speed that you can do while still kind of running in a more or less natural way.
Awesome. I know that some people use music when they run. Are there certain beats per minute that are best, or is it kind of person to person?
Yeah. So I think it was Jack Daniels that popularized the idea that 180 steps a minute is ideal. That 180 was really picked arbitrarily. Generally speaking, and this is kind of Amanda's area of expertise with all the gait retraining she does, running with the faster cadence, there's a lot of research that's come out in the past 10 years especially that's shown that generally is a very good low-hanging fruit to start with, and that kind of like gets at a lot of problems that we see with running very non-specifically. So whether it's knee pain, hip pain, just running with a faster cadence is better. However, I mean, let's say, for example, my resting cadence is 140. It's like boom, 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 very slow. If I go right to 180, does that seem like that's going to be a pretty drastic jump for me? Probably. So it really does need to be structured more, especially in the context of coming back from an injury. But yeah, especially if a runner is coming injured generally, and again, Amanda can speak on this, but we'll see more often than not, the cadence is pretty on the low side, like below or around like 160. So what a common intervention that we'll try to do is bump that cadence up by about like 5 to 10 beats, see how they vibe with it, and maybe try to train based on that. I hope that answers the question.
Yeah, I feel like, Amanda, you probably have some good playlists that I need to steal from you because mine are all over the place. So, all right. So kind of going with the cadence and, how to return, we had a question about running after surgery, or even I feel like this can be for anybody. How do I run without kind of pounding my feet on the ground? Do you have any tips to kind of lighten the run?
I think that kind of comes from that retraining of, like Jay was talking about, those like pogo jumps. We do a lot of like landing mechanics. They're kind of like your typical box jumps or death jumps, and kind of that landing pattern where you're not slapping your feet down the ground. You have that nice, quiet landing form is kind of what I look to start with first. And then that usually carries over into your running form. A lot of times too, there's something called vertical oscillation that as people run, they will bounce up and down tremendously, and they're using more effort to bounce themselves up and down than to push themselves forward. So sometimes even just like videotaping yourself running and seeing how much you're going up and down is a little bit more of being able to see it, and then kind of being like, oh, why am I bouncing up and down so much? I should use that to move myself forward. And that kind of then quiets down your feet a little bit as well.
Awesome. All right, moving on to a few questions that kind of are clumped together. So we're going to talk a little bit about foam rollers, because I feel like that's like a big buzzword right now with running. So can you just talk a little bit about what a foam roller is used for?
Yeah, so we like to use foam rollers kind of for that like flexibility piece that you're looking for, really those like tight bound down muscles that are just nagging you pretty much. So you can use it as a warm up, as a cool down for really any muscle. I'd say more in the lower extremity that you're looking for, but kind of your quads, your hamstrings, your glutes, your IT band, your psoas, calves, you name it, you could probably foam roll it. And I really like to use it sometimes as like that warm up cool down that you're looking for, to just kind of let everything settle down, relax. You're not just kind of jumping into a run or off of a run and then just continuing with your day-to-day activities where you're either having cold muscles, warm muscles, or things like that. I'm also going to pass it to Jay too and kind of see how he uses it as well.
Yeah, everyone uses it a little bit differently. My take on foam rollers and Theraguns and any other kind of like what we call soft tissue modalities is that, if they feel good to do, if it feels good to stretch, definitely do it. You can add it as part of your rituals. They are definitely not harming anything, so long as you don't, completely, you're not one of those like use the foam roller and just completely jab yourself with it. The only thing I'll add about that is, at least in the context of rehab, Amanda and I talked about so many different exercises and so many different things tonight that we use to assess the runner's readiness to return. And we touched on the importance of strength training, jumping, and doing all the other things. I would say just don't let that cut into like time that you have for like doing the other more like very basic, boring stuff that needs to be mastered in order to like keep your running good. So that's all I have to say on that.
Yeah, I think that's a great point. You did mention Theraguns, which was our next question. So are Theraguns a better option than a foam roller? What are your thoughts on them? Are they safe?
I mean, I've used one once, and that does not, I am not the authority on Theraguns. Again, I like to think of all these soft tissue modalities as a group. Again, they feel good, by all means, go on ahead, but that's just my opinion.
I'm going to say it's one of those things where if you use it and you like it, go for it type of thing. I wouldn't say that everyone needs to go out and buy a Theragun. Everyone needs to go get a foam roller versus a Theragun. It's kind of one of those things where if you're looking for a good option, it's a foam roller. If you want to be a little bit more involved into it, take the time, a little bit more of that cost benefit of it, go for a Theragun. It's one of those two things that we have in the clinic. People use every day, but it's not that one is more beneficial than the other. It's going to give you a better result. And like Jay kind of said, if these are things that if they feel good, you use them. Again, it's not going to all of a sudden fix your problem and make everything better for you. They're just kind of like subsequent things that we can start to add into your routine.
Awesome. I think that's such a good point. We like always want that quick fix, and foam rolling might feel nice, but it's just not enough. All right, moving on. So I was told I should cross train to improve my running. Can you tell me what this is? And do you have any tips on cross training for runners?
I can take that one. Cross training is anything that is not running that can be used to kind of improve your fitness. So if you remember the slide, the really long slide that I went over, that I definitely talked way too much in, I mentioned that running should not be considered as cardio at this point. And I brought up the idea that if your runner in front of you is someone that is comfortable with swimming or biking, that they should pursue those activities. That's exactly it. So, you see it a lot in triathletes. You see a lot in just like, I feel like people are generally getting smarter about this kind of stuff. So maybe not run every single day and just to take it easier on your body, but add in like maybe a bike ride, a Peloton, swim. But it could also be just kind of like something along the lines of a high intensity interval workout, something to work out like another area of either your endurance system or your strength system, just to give your body, more or less, I hesitate to say like an active rest because you are promoting like fitness in a different area, but kind of diversifying your training a little bit like that.
Awesome. All right, so moving on, do you have any suggested warm-up options before heading out for a walk, jog, run, any of those things? And then kind of on the other side, what would you suggest as a cool down? So, or the sandwich of the run.
So I think a lot of us, we live in Manhattan, we walk out of our apartment and we start running. Right away, we run right back to the door of our apartment and we go inside and we either do whatever you do in your apartment when you go back inside, and we forget about that warm-up cool down period. So kind of for a warm-up for me, if you're going out into a run, I like to tell my patients at least walk around the block first, get those muscles moving, try to get the blood flowing a little bit, and then you can progress into your run instead of just all of a sudden start running, start timing yourself and just full force going into it. That's where all of a sudden you're going to have those cold muscles and nothing's really going to be working in your favor, and then you're just not going to be beneficial throughout your run. And then for me, kind of also that cool down is making sure, again, you're not just stopping right in front of your door and walking inside. You're stopping maybe about a block or two away. You're walking around the block. Maybe you're running an errand, something like that, where you now have that time to kind of have that active rest period that we kind of talked about, where you're regaining your oxygen, you're having your blood flowing, but you're letting everything kind of settle itself down. Also, too, that is where foam rolling does kind of come into play sometimes too. You go home, foam roll out the muscles for 5 to 10 minutes, and then that's kind of like that active cool down that you have as well. I don't know if Jay has any other suggestions.
Yeah, no, absolutely. Just I think I have definitely been guilty of that myself. Just like going right out there. I got the next 30 minutes to run my 28-minute run, so I just got to go. But yeah, I think as Amanda said, it's nice to just take some time to let your muscles kind of like warm up and come to you a little bit, and also to kind of tail end it, like kind of get them, off of running. And I think personally too, I enjoy the warm up process to just kind of like mentally kind of declutter from anything else that might be kind of like leading me up. Because a lot of times I've noticed, and you can, I'm not really sure about Amanda, but my injury CV is pretty extensive as well. And a lot of times when I've been injured, I found that usually the runs that I'm very, stressed out in other areas of my life where I'm like just kind of not even like present for the run and just kind of pushing through it. Those are often the times that I personally end up in trouble. And I see that pattern borne out a lot in some of the patients that I work with. So not to sound super kind of like, loosey-goosey about it all, but I think that preparing mentally and kind of like protecting the run as its own entity, as its own activity is a vital piece of it as well.
Awesome. Thank you. All right, we got 2 more questions. So going off of that, talking about HIIT runs. So I like to do sprints as part of my HIIT workout. Any additional tips on safely returning to sprinting?
So sprinting is a little bit of a, yeah, you can start.
Yeah, I mean, I'll just kind of get it started. Kind of like with what I mentioned earlier about the running protocol, sprinting is a very explosive activity, right? And we want to kind of going off of, we want to progress duration before the intensity of the run. Again, what I'm about to say should be taken with a giant grain of salt because I do not know your injury, and make sure you get, the right protocol and all the things like dialed in for you. But you generally want to progress up to a decent bout of running. Let's say, tolerating about like, anything between 10 to 20 minutes of jogging. Then from there, when your body's conditioned to handle those loads, then you would gradually progress the speed until you hit your sprinting stride. Amanda, did you have anything to add?
Yeah, I was just going to comment that, like you said, sprinting is kind of like that last effort that we put into it, making sure that, you're able to go out for those 10, 15, 20-minute runs, because those are going to be the foot contacts that you're looking for. If you're jogging or running at a slower pace, then you automatically go to sprinting. You're basically doubling the amount of foot contacts that you're having in that short amount of time. So it's making sure that as you get that distance built up and able to tolerate that longer amount of a run with those type of foot contacts, then it can transfer over to a shorter amount of time with that same amount of foot contacts. So it kind of is a little bit more of building up the duration and then bringing it back down and increase your speed and shorten your time.
Awesome. All right. Well, I think that was all of our questions. You guys answered them so thoroughly. Thank you so much for that. And that's it for you guys. So we hope today's talk was valuable and that you learned more about returning to running and some treatment methods to manage and improve your symptoms. So if we didn't get to your question, or if you think of a question, you can always reach out to us directly afterwards. And as a reminder, your presenters for today were Jay Kwan and Amanda Kalin. Feel free to jot down their contact information. You can reach out to them directly if you have any questions or if you want to schedule an appointment. And then our Q&A moderator was Brett Warner, Assistant Director and Physical Therapist at our Park Slope location. So feel free to reach out to Brett or myself if you have any questions. We're happy to facilitate getting you set up with one of our amazing therapists. And then just as a reminder, we treat an array of conditions from head to toe. We're open for in-person visits as well as telehealth sessions. So if you feel like you could benefit from some individualized guidance and treatment, please reach out to any one of us and we'll personally coordinate you being set up with one of our team members that is a best fit for you. And then lastly, this is our final webinar of 2021. However, we're excited to bring you more webinar content into 2022, so you can find us again in January, covering a variety of topics, and we look forward to seeing you there. So follow us on social media or check your inboxes to learn more about what is up and coming. And then thank you again for spending time with us today. We hope you enjoyed the webinar and we wish you the best. Happy holidays and Happy New Year. Thanks, guys.